The audit was completed in April of last year, but had not been made public until today. Minister Sacramento said publishing both this audit and the Mental Health Board report were two of her immediate priorities when she became Minister for Health just under 3 months ago. She said she would have done so even sooner, but wanted to publish the findings only once she had a clear plan of how best to confront the issues found therein.
The first thing I did was to look at the report, always intending to publish the report as soon as possible. But what I wanted to be clear on at the time that I published the report was to have a very clear and robust implementation plan of the recommendation that the report makes. Now, I've been working very closely with the senior team at the GHA, with the medical director and with the head of mental health services, and they have prepared a roadmap for implementation.
Ms. Sacramento and Medical Director Dr. Rawal made specific mention of plans to audit the use of prescribed medications, of facilitating home visits so as to be able to treat patients more easily, and of giving particular attention to the issue of male suicides. The ministry will also be conducting a public, anonymous survey on mental health provisions on the ROC, saying the only way to make real improvements is to understand how the public feels about the service.
We'll be looking at better data collection in mental health services to allow us, as a health authority, to allow the government to understand the patterns of mental health in the community and allow changes over time, and that applies across the board with all healthcare services in fact, but of course this is a very important one for us to understand where the community is perhaps under pressure, where the community is under strain, and how we can better provide care.
Joining the Minister and Medical Director were Ian Walker, who authored the audit, and Karen Buckley, who will be tasked with directing projects in the new year which will implement change.
As the system has developed, it could have been able to be more coordinated between the different bits of the system, and so one of our main recommendations was that the different parts of the system worked in a more coordinated way together, and so that was really one of the key findings of the report. And another thing, we recognise that there is still some stigma that remains about mental health.
This week has been meeting with internal GHA stakeholders and getting a kind of scoping and an idea of how to take that forward in the new year. There's clearly lots of successes already, and the key thing in the mental health system will be coordinating that and bringing that together strategically.
A link to the full audit is available on our website, and GBC will be bringing you a full report on the audit as well as reactions from stakeholders next week once a more thorough analysis has been conducted.